Hi, this is Cole Martin, and my mom is gonna talk about polycystic ovary syndrome.
Good job. Okay. Okay. My name is Kate Martin. We're going to talk about PCOS. Okay, come on, let's go. Come.
I'm gonna open this.
Okay, go ahead. Go. So PCOS is a common hormonal disorder. The estimation is that it affects about 10% of women of childbearing age, and also that there's an estimation that about 70% of the women that are affected by PCOS are actually undiagnosed. So this is a highly undiagnosed syndrome. The classification is a endocrine and also a reproductive disorder because it is an imbalance of hormones and also a resistance to insulin. So, and it causes infertility, or it has the propensity to cause infertility, so it can also be considered a reproductive disorder. So the actual cause is still unknown, but we have identified the etiology as an increase in androgens. And androgens are a male sex hormone. So there's an increase in androgen in women that are affected by PCOS, which causes a lot of symptoms that could be, that you would see in a normal male. These symptoms are put onto the female. It also causes a resistance to insulin, which causes a whole other myriad of symptoms associated with that. It's polycystic ovary. The name comes from the multiple cysts that you'll see on a person's ovaries. So the clinical manifestations, the most frequently seen things that we see are irregular periods, completely absent periods, or extremely heavy periods that also come with a lack of ovulation. So this leads to a lot of issues conceiving a child. And I read that most women that actually seek care for this disease, they come in their 20s and 30s. They're most likely to be diagnosed in their 20s and 30s. After they are unable to conceive after a while, that is when they actually seek medical attention. So the irregular cycles, the difficulty conceiving, patients with PCOS frequently experience hirsutism, which is an increase in facial hair and body hair. This is because of the increased androgens. So women will, with these elevated androgen levels, they'll have like facial hair on their chin, their mustache. They'll see hair on their chest or their back like you would see with a man. There is an increase in abdominal fat with PCOS, and there are a lot of issues with losing weight. Frequently, patients with PCOS have obesity and have a really, really hard time losing that weight. You have a lot of issues with anxiety and depression and mood swings that go along with the hormonal disorders. And obviously you have ovaries, you have many cysts on your ovaries that can also lead to the issues with the menstrual cycle, increased bleeding, increased pain around the time of your cycle. Some important diagnostic tests. So I think the most important diagnostic test that you'll see is a pelvic ultrasound. When you do a pelvic ultrasound on someone with PCOS, you are frequently able to appreciate many just benign cysts all over the ovaries. This isn't to be confused with ovarian cysts, though. That's a completely separate. You can just have ovarian cysts by itself. So in order to diagnose PCOS, you need to have the multiple ovarian cysts in addition to a multitude of the clinical manifestations, such as hirsutism, different lab values being completely off, other symptoms, in order to confirm that diagnosis. You can't just diagnose PCOS based off of ovarian cysts on a pelvic ultrasound. Some lab tests, you are going to see an increase in androgens, male sex hormones. Testosterone is one of the biggest ones. DHEAS is another one. You'll see a elevated luteinizing hormone that is disproportionately elevated compared to the follicle stimulating hormone. You're going to see an increased fasting insulin rate, an increased fasting insulin level, and impaired glucose intolerance. So that's a test that I had when I was pregnant several times, where they give you a glucose drink, and 2 hours later they check your glucose level, and a normal person should have already absorbed all that glucose, and your glucose level should have regulated in your blood. However, with someone with PCOS, it's going to take a lot longer to actually absorb, to respond to that insulin. So you're going to have an impaired glucose tolerance test. What else? Your differential diagnosis. You have Cushing's disorder, which is an increase in cortisol, either from taking steroids for a really long time, or you can just have an innate high cortisol level where your adrenals are just overactive, and that will cause a lot of the same symptoms. So the way that you could differentiate is from actual cortisol levels, where you would see an increased cortisol in a Cushing syndrome, as opposed to a PCOS patient would not have an effect to their cortisol levels, and their labs would really just indicate the androgen, the increase in androgens, as well as the insulin levels. Another effect, another differential diagnosis would be congenital adrenal hyperplasia. Remember that the adrenal glands are responsible for your androgens. So if you have a overactive adrenal gland, you'll have the increased androgen levels in a woman, and you'll see a lot of the same effects as far as the body hair, the facial hair, the thinning hair on top of the head, but you won't see any of the other effects as far as the polycystic ovary disease, the cysts all over the ovaries. So I think probably the most effective diagnostic tool that you have to differentiate there would be imaging of the adrenals. If you could see that there was an increase in size to the adrenals, maybe there's actually an adrenal issue as opposed to the hormonal imbalance associated with PCOS. Some possible complications. There are a myriad of different complications. The biggest complication I think that people seek treatment for is the infertility. So the hormonal imbalance associated with PCOS will cause anovulation, so a person would have a really hard time conceiving. The hormonal imbalance, as well as the insulin sensitivity the insulin resistance is going to cause a lot of early miscarriages. And then if they are able to get pregnant, you'll frequently see preterm labor, just because your body isn't regulating all of those hormones the way that it should be. So infertility is a huge effect of this. The insulin resistance causes a myriad of issues. A person with PCOS and insulin resistance is at high risk to develop metabolic syndrome, and also to progress to type 2 diabetes, just because they have a long-standing history of their insulin being resistant. And then diabetes and long-term insulin resistance, obviously, just like diabetics, we see have just a myriad of complications, many of them being cardiovascular effects. So you see a lot of hypertension, increased risk for stroke, heart attack, hyperlipidemia. All of that is associated with the insulin resistance that comes with PCOS. Complications as far as the increased weight gain, also something that is just, it wreaks havoc on your body when you have all of this extra body weight that you are have the hardest time losing with just diet and exercise. So obesity can lead to obstructive sleep apnea, again, hypertension, risk of heart attack, risk of stroke, and then anxiety and depression and mood swings associated with any hormonal disorder would be the final complication of PCOS. There's a lot of promise in, recently there's been a big boost in prescribing semaglutide, which is a diabetic drug to help with the insulin resistance. It's known as Ozempic and Wegovy, and it's commonly been used for weight loss, just like an off-label, but it is a diabetic drug. So this has had a lot of success with PCOS patients, because it battles those issues with the insulin resistance, as well as helps people with PCOS lose weight, which solves a myriad of other issues just by itself. And can actually, those two effects of one of those Wegovy or Ozempic semaglutide drugs can be that all of those lab levels, your hyperlipidemia, your high fasting glucose, all of those things tend to resolve. And they've actually seen some success with PCOS patients' menstrual cycles regulating and improved fertility without having to resort to using things like IVF. So that's huge. I'm really excited to see more research on that, because as a woman who had no issues, as you can see with my 2 kiddos, I had no issues conceiving them and carrying them to term. This disease really just kind of struck a nerve with me. So I'm really hopeful to see what kind of treatments they are able to come up with in the future that can make a difference for some of these women. So that is all I have for PCOS. Thank you so much for hanging out and learning about PCOS with me. I hope everyone has a great day.